clinic was bustling. Mr. Kamal sat clutching a tissue, his body racked with a persistent cough that had been bothering him for weeks. He also noted increasing shortness of breath, making even simple tasks feel exhausting. He suspected it might be more than just bronchitis, which he had experienced in the past. Across from him, young Sarah fidgeted nervously. She had been diagnosed with asthma as a child, and the change in season always triggered her symptoms, including noticeable wheezing. Her mother kept a close eye on her, ensuring her nebulizer was within reach, ready to deliver the much-needed medication. An elderly gentleman, Mr. Fuad, sat with an oxygen tank beside him. He had been living with chronic obstructive pulmonary disease, COPD, for many years, a consequence of a lifetime of smoking. His breathing was labored, and he often experienced significant shortness of breath. Today, he was here for a routine checkup and to discuss managing his condition during the upcoming dusty weather. A young man, Ahmed, looked pale and weak. He had recently been diagnosed with pneumonia, an inflammation of the lung. He was still recovering and experiencing occasional chest pain. His doctor had emphasized the importance of rest and completing his course of antibiotics. Later that morning, a somber mood fell over the clinic as the pulmonologist spoke with the parents of a young child diagnosed with cystic fibrosis. The genetic condition caused a buildup of thick mucus in his lungs, leading to chronic respiratory infections and difficulty breathing. The doctor patiently explained the long-term management plan, including chest physiotherapy and medications. Meanwhile, in another room, a patient was undergoing spirometry to assess their lung function. The technician guided them through deep breaths and forceful exhales, the results of which would help the doctor understand the extent of their respiratory issues. Suddenly, a nurse rushed to assist a patient who was experiencing severe respiratory distress. The patient was quickly given oxygen, and the doctor assessed the situation, suspecting a possible pleural effusion, a buildup of fluid around the lung. Throughout the busy day, the pulmonologist and their team worked tirelessly, diagnosing conditions, prescribing treatments like CPAP, continuous positive airway pressure, for patients with sleep apnea, and providing support to those struggling with various respiratory illnesses.